Hello, and welcome back to Authentically Shauna with your host, Dr. Shauna Burke. I am joined on my first interview podcast by Oliver Hartan, who is a certified matrix repatterning practitioner and a lead instructor. And I'm just going to publicly, probably embarrass him and tell him that he's one of my favorite instructors I've ever had. I'm currently in the Toronto area doing quote unquote core skills 2 of level 1 certification of matrix repatterning. And I wanted to share what this technique is about and talk to someone who has really influenced the path that this technique is taking. And I can't wait to let you hear Oliver speak because he's such an amazing, clear speaker, one of my favorites. So, Oliver, thanks so much for being here. I want you to tell me, what is your definition of matrix repatterning?
Well, first of all, thanks, Shauna, so much for having me. I'm very happy to be here. And my definition of matrix repatterning, well, I guess the first thing to understand what the word matrix means, which is network, right, or web work. And so when we look at our body, there's no part that's disconnected from another. And our body is biomatrix. And so understanding that as matrix repatterning is the goal or the approach of repatterning a part of our biomatrix that becomes distorted. And this happens all the time with significant injury. So anytime you have a nasty fall on your butt, or you have your arm reefed, or you get a concussion, the force actually is enough to distort the matrix of your body down to the cellular level, and it gets stuck like that. Now, a couple of weeks goes by, you're out of pain, unless it was really bad, and you're thinking, I'm good to go. Injury's healed, I'm fine, not a problem, right? Wrong. There's still something there. Your body has compensated around the injury a lot of the time and left a residual strain pattern that you're now consciously unaware of. Your matrix, the cellular structure has been distorted, leading to what we call in the matrix repatterning world primary restriction. And so what we're doing with the therapy is really unearthing where all of these underlying hidden strain patterns are in the body and how they specifically relate to our main complaints, whether it has to do with reduced movement or pain, or maybe even digestive complaints or stress incontinence, cognitive issues after a concussion. The list goes on and on. We're looking where these hidden strain patterns are. We're detecting them in a very precise manner. And then we're using exciting and powerful treatment method to actually repattern the distorted tissue, allowing the body to return to a pre-injury state. It's a beautiful, elegant approach.
And why do you think you were drawn to this method? I mean, there's so many methods in the world. What made you say, okay, this is what I want to really invest my time and my career and who I want to be as a practitioner in?
Yeah. Well, that's an interesting one because I was trained as a massage therapist.
Wait, can we clarify? Because
Yeah.
a massage therapist in Canada is a very different thing. I would say it's almost comparable to being a physical therapist in the States. So tell us a little bit more about what being a massage therapist is in Canadian.
Yeah. Thank you for that clarification. It's quite involved. In my own training included 2 years of 2,400 hours, actually. That's over 150 hours of anatomy, physiology, pathophysiology, clinical decision-making, hours and hours of clinical decision-making and actually in-clinic work. It's involved and is, in my understanding, equatable to physiotherapy, physiology, and anatomy training, as well as orthopedic tests. We have a whole course, 2 years of orthopedic testing. So it's quite substantial. So as a massage therapist, I learned all those tests. I learned all about the anatomy. I started to do what I could to help people improve movement and reduce pain, but I was running up against some serious barriers. I noticed with complex cases, I was only able to improve their symptoms for a short period of time, and then it will come back. And so I was acting kind of like a maintenance worker, helping them feel better for a couple of days, maybe a couple of weeks, and then they come back again. And I knew that I was missing something. Something was wrong in my understanding. I went on to study structural integration, which is like a less intense form of Rolfing. And I found that to be effective. That that helped me dive into the world of fascia, and it made my techniques a little bit more effective, but still I couldn't really improve things on a permanent level. And I had no idea how to address concussions and all of these complex issues. And I had this intuitive feeling that there had to be some sort of manual therapy out there that could provide outstanding results again and again, that was easy on my body. Because at that time, me trying to do treatment, and by the way, for the listener, of a slight build. Yeah. So, imagine me 130 pounds trying to,
What? Yeah.
yeah, yeah,
With ski clothes on. Yeah.
yeah, like trying to muscle into a muscly guy or a heavy set person. It was breaking down my body. And actually the attrition rate of body work is rather high. A lot of massage therapists retire early.
Yeah.
Yeah. Because they get burnt out, or they have bad ergonomics early on. They get repetitive strain issues and they're done. And I didn't want that. And I felt myself in pain. I felt frustrated with my ability to not help people in the way I wanted to. I was looking for different techniques out there. So one day, somebody said, "Hey, have you ever heard of matrix repatterning?" Because they knew I was trying different courses and checking. It was one of my colleagues. And I said, "No, but that sounds really cool." And then I forgot about it for 2 months. And then 2 months later, I was at another course dealing with, it was called Rekinetics, and it was a neuromuscular retraining program. Very cool. And the clinic director that was hosting this event happened to be a certified matrix repatterning practitioner, fortuitously. And I was like, whoa, this is synchronistic, you know? So I asked Denise, I was like, hey, can you tell me a little bit more about matrix? So she told me, and it really piqued my interest enough for me to take the intro course. And at the intro course, I was blown away. I signed up after the intro course. I knew I needed to learn more about this. It was what I was looking for.
Walk me through what makes you take a course and then decide to be a lead instructor and then decide to be on the education board. Like those are big jumps in lots of people take courses. Like what made you go, this is something that I really want to invest my future in?
Yeah. Well, I have a passion for sharing information, and something I haven't shared yet, and I'll do now, is that I have a background in teaching at the college level. So I actually taught anatomy and physiology at the college level and massage therapy school, as well as a traditional medicine school. I also created curriculum for the one school, and it's just one of my things. I like public speaking. Apparently, the fear of public speaking is right next to the fear of death. There's some statistic out there, but I like it. And that's what drew me to wanting to be part of Matrix on a deeper level, relating to the educational board, relating to development of the education program, and all of the technology that relates to Matrix, the specialized Matrix scanner that's used within the therapy. I helped develop the casing. I have a real interest in R&D. And so I guess it's just an internal passion of mine to be a part of that process. So that's what drew me into teaching. Did you have another question related to that? Was there a side question? I can't remember.
Maybe. Or it was just like, how do you go from taking a course then being like, I'm all in, like, I'm ready to, I mean, you have spent a substantial amount of time creating videos, figuring out curriculum.
Yeah.
Like, that's a whole other world besides just being a practitioner. Yeah, I guess I'm interested in like, why? Because it could be really easy for you to really be good at this skill, which I know that you are, and just stay in your clinic, do your thing,
Yeah.
and but instead you choose to do something which is very different from that.
Yeah. I guess to the first question, why take a course and then just dive in so deep, is that it spoke to me and I could see with my own eyes what was happening. So, for example, a few years ago, a young lady came to me with a fracture, non-union, 5 years, with a congenital condition. Her mother and her they were so like at the end of their rope. The medical field couldn't help them, so they came to me wondering whether I could help. And I was like, I don't know, but I'll try. Right. And treatment was able to turn this young lady around to where she was able to weight bear. The bone finally healed. They removed the rod from her leg, and Matrix changed her life. Me being part of that process is so gratifying. I think For me, it's the high. Like when I can see people recover from 30 years of pain, you just see it in their presentation, in their eyes, and how they talk. It's the best thing ever. I love it. So whenever that happens, and it happens quite regularly, to be able to help people shift out of such a deep, dark place and have their life turn around, it's so rewarding, so gratifying. And Matrix does that for me. And that's why I love it, and I'm all in. And on the educational front, I want other people around the world to have access to it. Like I'd love for every PT in the US to have access to it. I'd love for other chiros and health professionals to have access to it. And if I can be part of that process to share this information to help people experience what I'm experiencing right now, then I love it. That's all I want to do.
How do we do that? Like, how do we take what we learned in school, because we both went to school where we were taught anatomy and physiology and all of these things that are really important. And then, at least for me, it felt like you learn all this and then there's not really a way to apply it.
Yeah.
It kind of goes like, here's all of the tests, here's all the knowledge, and then like we can't really tell you how to apply it. Like, good luck.
Yeah.
Which is how I felt. And so how do we shift that in a really big way? Because I know I'm not the only person who feels like that. I know you felt like so. Like, I think that's a very universal feeling that
Yeah.
us as practitioners have. And so what do we do to change that?
Yeah, I agree. It's the same thing I experienced in massage college. They taught us all these orthopedic tests, the same ones that PTs learn, but they didn't really teach us how to put it all together. It's like, okay, here are the tests, but we're not going to show you how you do a massage and then actually follow through a proper assessment, treatment, and reassessment. And I guess at the end of the day, my techniques, the massage techniques, which were really good techniques, they weren't changing the orthopedic tests,
Right.
frankly.
Correct.
Because I retested them and I was just like, why did I learn all these tests? I can't even make a difference. Total frustration,
Yep.
So it was only until I came to Matrix, and I'm sure there's other therapies out there, but I can speak to Matrix repatterning because I am an expert in this field, where I could actually use a manual therapy to affect an objective finding. Meaning I could do some Matrix treatment and I could go back and do an orthopedic test like Trendelenburg test. Suddenly hips are firing great. There's no Trendelenburg sign. I could and go check a neurological test. Reflexes are normalized. How is that even possible, right? And I think what it comes down to it is the actual treatment techniques need to create proper, effective change to where you can remeasure that change. If the treatment techniques don't make the change, then you're not going to see any measurable improvement. And so I think that's the first thing, is to help practitioners understand what are the true underlying issues that are causing the deficiencies in muscle firing, these positive orthopedic tests. Like, what is it? Where is it coming from? And I think that is the focus of all therapists. They want to know, okay, where is it coming from? Where's the main issue coming from? How do I find it? How does it relate to these objective findings that I'm seeing? And this is what Matrix does so well. It has a process in place, a very elegant process to figure out where these hidden strain patterns are, and then being able to treat an area and then retest in a way to show you that you actually improved that objective finding, like a range of motion or stability or other neurological orthopedic test or whatever kind of test you're using. So when it comes down to it, in summary, I guess for all the practitioners out there, we need a kind of an elegant, simplified approach to assessing the body, then an actual effective treatment that makes a change, and then the ability to go back and retest those findings to prove to yourself as a practitioner and to the patient that change has actually occurred.
Yeah. I I think that was like the original intent. Like I always hope like that was the original intent of every practice that started, whether it was massage, chiropractic, physical, I think all of these things started with that intention of we're going to create tests and then we're going to create treatment and then we're going to. So what do you think that everyone missed? Because I feel like every field has missed this, right? It's not just it's not in one part of the world that's missed it. It's not in one technique that's missed it. Like, how have we all what's your opinion on how we've all kind of missed, like, these, what we call in matrix patterning primaries? How have we all missed these big, like, blaring red flags once you know that they're red flags? How have we all missed this?
Well, I guess what's unique to this process of matrix repatterning is to be able to isolate and identify where these strain patterns exist. You can't see these things on an MRI. You can't see them on a CT scan or an X-ray. You can't see them necessarily with your naked eye. You can't necessarily palpate them. How do you find them?
Right.
Right? That's where you need to understand the electrical nature of the body.
Let's talk about that.
Yes. Yeah. That's really exciting. And we've all had a static electric shock. I think we all understand that the body is a conductive structure. It can move electricity. And wherever there's electricity, there's magnetism. So they go hand in hand. So the body is really an electromagnetic being. Those two elements are at play. Now, wherever you have an injury pattern, the matrix, again, is distorted. Okay, so the tissue is distorted, the cell structure is distorted. And within that distortion, you have augmentation of the electric charge and the magnetic field. It's like altered signatures of electricity and magnetism at play. And the analogy I use is you could, say, go to the beach and pull out your metal detector, hunt for some treasure, right? And scan the beach looking for this. And as soon as your metal detector passes over a metallic object, it'll beep, 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 it'll actually indicate, right? And so if there's a method, and there is with Matrix, to identify altered electric and magnetic signatures in the body, all you need to do is know how to scan the body, like scanning the beach for treasure with your metal detector. That's what matrix patterning offers, is a method where we can scan the system, the whole body from head to toe, and identify where specific regions of the body are altered. Okay. Every strain pattern that shows up that is evident in the body will have an altered electric charge and magnetic field, and you will be able to find that in the scan, whereas other methods won't. And that is a big help, because that makes my life so much easier. Any therapist out there that is wanting to figure out where's the hidden strain pattern? Where is it? How do I find it? Well, if you can find the electrical signature that is disrupted, you're good. You found it. The next step is to figure out what to do about it.
So let's talk about, we live on a planet with gravity. And
Yeah.
you talked about a lot of us have taken falls. How well do you think that most of us have compensated to get to where we are in life without noticing things? And then I feel like we attribute a lot of degradation, I'll say, of joints to old age. And I'd like to know what your opinion is on if you think that that is aging when people need to get joints replaced, or if you think that's a combination of lots of strain patterns that have just sort of caught up and really been focused in one joint.
Yeah. Well, I mean, first of all, the body is excellent at compensating for injury. It's so good at that. We'll go years without having issues. I find usually when people get into their 30s, say they've been moderately injured over the years, they get into something seems to go downhill from that point. Other things start to diminish, like hormones and that sort of thing. But uh, people notice this. They don't heal as quickly. They can't rectify their pain with exercise or stretching. The usual conventional therapies that would work don't anymore, right? So I feel like by the time you get into your 30s, you've had enough accumulated injury and corresponding compensation patterns. It's enough. The body can't handle it anymore. And so it's a bit of a breaking point. And so the brain and its wisdom and the nervous system says, you know what? I've had enough. There's an issue here. There's a problem. We've got to figure it out, right? We can't compensate any further. And so that's the whole compensation side of things. Regarding like joint replacement and aging and all of that, I'll tell you what I tell people coming to see me with osteoarthritis, for example. They come in to see me, like, yeah, I have osteo on my knee, and I went to see my doctor, and he said it's because of my age. And so I say to them, it's the osteo's in your right knee, right? Yeah. Well, isn't your left knee the same age as your right knee? Right? It's like your knees are the same age, but you only have osteo in one knee.
Right.
Is it aging? And they're like a light bulb goes off. It's like, well, maybe it's not aging. No, it's not. It's wear and tear. It's injury to the knee. It's injury to other areas of the body that have shut down the proper biomechanics to your knee, causing chronic micro trauma. And so there's a breakdown. But as we know, many of us do know that the body's always breaking down and it's always building back up again, right? With osteo patients, as an example, it's just the breakdown's faster than the rebuild. So just remove all of the factors that are causing the breakdown and they can start to rebuild again. And that can be a little bit of a contentious proposition that you can turn osteo around, but other people believe you can, and doctors believe you can. It takes time, but you can turn osteoarthritis around if it isn't that far gone. And I've seen changes with my own patients.
And so what's kind of the point of no return, right?
Yeah.
Because our bodies do have limits, unfortunately.
Yeah.
So what is that kind of limit that bodies face?
It's always hard to say what the point of no return is, because I've seen people in their 80s who've had gnawing back pain for 30, 35 years, and in 4 sessions, it's gone, right? You'd think there's no return from this. You're 80, your posture's failing, you're not coming back from this, but they do. Whereas other people, they don't, right? So in my experience, matrix repatterning isn't a cure-all, but the success rate's very high. And I think it's multifaceted, when we really look at the health of the body, it's multifaceted. We've got the electrical system, we've got the biochemical system, we have all of these different elements that are contributing to wellness, how stressed we are, what's our diet like, where do we live? Are we getting bombarded by toxins from our environment or excessive levels of electromagnetic frequency that might be disrupting our tissues, you know? And so it's many things. What I say to people is I can rule out all of the physical stuff, all of the physical strain patterns that potentially are contributing to your issue. I can rule all that out. And if anything is persisting, then we probably want to look at some other things like internal medicine, work with a functional medical doctor, or work with a naturopath, work with specialized, like a practitioner specialized in neuromuscular therapies. You might need some specific assistance beyond just what I do. But yeah, I think the point of no return is very hard to say. And to all of those out there listening that may feel like they're at the point of no return, I say have hope. There's usually a way out. Don't give up.
Yeah. I can say that that's been my case with this modality as well. Um, I want to ask you why you think we have this mentality as humans that if it's not quote unquote broken, like if we don't know something's wrong, why we wait until something is wrong, right? Like most of us don't do maintenance on our body. We do maintenance on our houses, on our cars, basically on all the things we own besides us. Like it's a very, and I'm not sure if that's it happens in Canada as well, but I know in America, it's like, well, unless something's wrong, I'm not going to be proactive about it. And so how does Matrix sort of fit into the proactive, and especially as you're saying, like around 30 years old, people are having a lot of changes. How can we help people be more proactive so that it's not like, oh my gosh, when I get pregnant, when I hit menopause, at least in a female perspective, I think there's so much um discourse
Yeah.
in those times for people because I think it's just everything is kind of like smacks and like hits you and you're like, I didn't even know this was a thing. So how do we help people like get ready for these things?
Yeah.
How do we start making that more a part of the narrative?
Yeah. Great question. I guess there's a bit of psychology that plays into this too, right? And I don't know if this is worse with some people, like one sex over the other. You hear that stereotype, like men just really bad about taking care of themselves, right? um, but stereotypes aside, I don't know what makes it hard for people to pre-act, right? Set up that connection with a therapist, set up those sessions, and just figure it out, ahead of time. Is that because it isn't in our consciousness? It hasn't been introduced to us. Certainly me growing up in the town that I grew up, there was one massage therapist. There were some chiros around. Financially, we weren't of the means that I could even go. So, and that's my generation. And my father and my mother, there was no massage therapy. Like, you know what I mean? So maybe it was just the times, and perhaps we're at the time now in our culture where we need to change the mindset about pre-acting. And that's a term that I learned from Eben Pagan, who's an American entrepreneur, and he does amazing stuff, amazing work. But he compares the difference between proactivity, and pre-act. To be proactive is to go to the gym to get strong. To pre-act is to set up 8 sessions with a personal trainer. You know, that locks you in for success. That really sets you up for success. So to pre-act for your wellness would be first to understand what goes on in your body with injury. I think the awareness is just not even there.
Great.
You know, this conversation, I think, will help people understand that there's stuff that happens with injury. We need to look at this. So I'll give you an example. When we're younger and say we have a really bad fall on our knee or we twist our ankle badly and it injures the growth plate of the leg, that leg may grow at a slower speed. It'll actually stunt the growth of that leg. Say this happens when you're 10, so you get it up into 14, 15, and you're still growing, but that injured leg is growing at a slower rate. Now you have structural leg length discrepancy. If you don't fix that before you're 18, 19, 20, and the growth plate closes out, you're left with a lifelong shorter leg, which is going to likely cause all sorts of issues, pelvic imbalance, muscle imbalance. If you got to it before that growth plate closed out, you could fix it. And I've done this a number of times with younger people. If people just knew that this was a possibility, right? And the same thing goes for a woman heading into childbirth and pregnancy, right? Clear all of those strain patterns from the pelvis, from the low back, right? The delivery will probably go better. I enjoy helping people in their younger years. I enjoy helping everybody. But if you can rectify the issues in a teenager, you're going to set them up for a life of success. So what's holding us back? I guess just the awareness. How do we make people aware? Podcasts like this, I guess, and getting more information out there that allows people to learn about these concepts. And that's what I would say to that.
Okay, there's something that I also wanted to ask about, a word that we had talked about before, which is instability. And I like racking my brain back through PT school, and we obviously talk about instability, but the thing that we didn't talk about was instability is higher order sometimes issue. I think in my brain, instability, and so when I'm saying instability, it's like a muscle that is having a hard time engaging. And I think my understanding during PT school is like, well, you have to strengthen that muscle. It's unstable because it is not strong. And I think Matrix has a totally different view of that. I'm sure other modalities do as well. But can you talk a little bit about like what is instability, what causes it, and why I think so many of us have instability that we aren't even aware of?
Yeah. Well, yeah, I agree. That what you were taught in PT school was taught to me in massage school. It's weak, strengthen it. The ligaments are lax, anterior, posterior drawer test,
What's your test on the knee to say, oh, you have anterior knee instability, you have posterior knee instability.
Right. And so the bottom line is that if the muscle isn't wired, meaning the neurology, the nervous system isn't sending the necessary contractile messages to that muscle, it won't fire. It will not fire. So the next question is, what's causing that mixed messaging? What's causing the delay of information? Where's that coming from? And there's different modalities that look at that. From a matrix perspective, we're looking at specific injury patterns within different regions of the body that affect that message signaling. So, for example, instability of the knee. We often will find that the medial hamstrings, the popliteus, which is the muscle behind the knee, they're not firing efficiently. This is causing anterior and posterior instability of the knee. The knee is sloshy, it's giving out. And what we notice is a lot of the time, the muscles are not firing properly due to injury patterns that are present in the thoracolumbar region, in the spine, and sometimes elsewhere in the body, as far as the head and the neck. And so, again, it goes back to being able to figure out where are these hidden injury patterns, right? And with Matrix, what you can actually do, because you have the use of this normalizing magnetic element of the scanner, which we haven't talked about yet, but you have that, and you're able to actually place that over the injury pattern and temporarily normalize it. In doing so, you reinstate or reestablish proper communication from the spine down to the knee and back again. You provide proper communications through the cell structure, and instantly the muscle turns back on. So if you're trying to, say, strengthen a muscle that's not firing, it's a non-starter in my opinion. But people notice this too. They come in, they say, yeah, I used to have knee issues, but they're all good now. I'm like, okay, what'd you do? Well, as long as I do these exercises, it's okay, right? So what they're doing is they're maintaining just a little, like a temporary, or I should say ongoing state of strength at a joint that's not firing properly. But as soon as they stop their exercises, it'll instantaneously shut down because they're not engaging it consciously and in a specific manner, and they're prone to injury. So when people are trying to strengthen that weak muscle, they're trying to strengthen it on top of a neuromuscular inhibition. It's like, it's so frustrating, you know? And for all you athletes out there, if you're trying to make gains and you're struggling, there's a neuromuscular component, right? And so if you can get those muscles to turn on properly and efficiently, and then start your exercise program, you're really going to see gains. Right? And so for the average day person who's not an athlete, they ask me like, hey, do I need to do a specific exercise? I'm like, well, let's see. Probably not, because just the act of walking, just the act of getting it up out of the car, up and down steps, is going to reintegrate that muscle and strengthen it, because now it's firing properly, because we've actually addressed originating injury pattern that in in your case was in your thoracolumbar.
Yeah.
Yeah.
So I'm not sure if this is true in Canada, but in America, we sort of have a low back pain epidemic. And, the thing that we got taught in school is there's like 1,000 reasons that people have back pain.
Yeah.
So good luck, because you're going to see everyone who has back pain for everything, right? Because pain can be referred because you name it, you could have back pain. You could have gas. You could have indigestion. You could have broken a rib. Like, there's so many reasons why people have back pain. And I think I'm going to say difficult. Like, I'm a physical therapist, and it's like, I see people with back pain all the time, and I don't know why they have back pain. I have no idea. It's just, I'll see imaging, right? We talked about, you can't always see something shows up on imaging, and not that imaging is bad. Sometimes it can tell you some good information. We've gotten in school, they were like, well, MRIs aren't that helpful. Like, so you can see it and you can tell someone they have back pain. You can read an MRI, but again, that doesn't give you a treatment for that. It's just like, okay, well, this person has a slip disc. This person has stenosis. This person has hyperkyphosis. Like, there's all these things that we've diagnosed people with having, but there's no treatment for those things. It's like, well, you'll just get better or you won't. Like,
Yes.
and so how does Matrix help that? Because I think a lot of people would be interested in knowing how Matrix helps with back pain. Not that it's much different of a discussion that we've already had, but if you could maybe specifically talk about
Sure.
the thoracolumbar region and the back, and yeah.
Yeah. Yeah. Well, it relates to what we're just talking about with stability. And it's true, we have a back issue in Canada. Is it a pandemic or a epidemic, or is it widespread? I would say yes. As a massage therapist before I got into Matrix, I was so disappointed in my ability to help with low back pain. I figured, massage the glutes, the legs, the hamstring.
Well,
Right. It worked.
so as
Get better. And it often did not. And I realized there had to be something else. So with Matrix, a lot of the time when we're looking at, say, back pain, we're looking at a stability issue. We're looking at a joint structure that is not fully stabilized, and therefore there is constant micro trauma on the deep tissue. That opens up another conversation. Why is it unstable? And what's going on there? So whenever it comes to, say, shoulder pain or knee pain or ankle pain or low back pain or spine pain, there's usually an instability issue. And what we need to do is figure out where those strain patterns are in the body. Where are they that are contributing specifically to the low back? So within Matrix, we teach and we also display this to patients how their muscles are not firing properly, and then locate the injury patterns, the strain patterns that are shutting down the muscles. Then treat those regions instantly. The deep stabilizing muscles of the low back turn on, and low back pain, lo and behold, goes away. If the low back is chronically unstable, you're going to have more strain on the discs. This can lead to disc herniation, right? Slip disc. This can lead to stenosis, right? Over time. And so it's really as simple as that. You really often, I don't want to give it absolute, but often you will not correct a joint pain unless you correct the stability issue. And that goes for low back. Now, people will often try to just do core exercises, low back exercises, and that certainly does help, and they notice that it helps, but they haven't figured out the underlying hidden strain patterns that are causing the shutdown of those muscles. If they could, then they wouldn't have to even do those exercises, or they would just do them because it makes them feel good, not if they stop, they're going to be in pain again,
Yeah, which brings me to another interesting point, because people will come to see you for physical therapy, right? And I will prescribe them exercise. And then the idea is that you keep moving, right? And one of my clinical instructors said to me, or said I was there and there was a patient there. It was like, if you don't continue to do these exercises, your issue will come back.
Exactly.
And that's sort of standard of care, is we're going to teach you what you need to do to maintain the level that you're at.
Yep. Yeah. And who actually does that? I can just say personally, I'm not going to be doing exercise for the rest of my life. Nobody does. You have a set of exercises.
Right.
You might last 3 weeks.
Totally.
Right. Maybe you have real troopers and they do it. Some people do.
I've met 2 people who've had surgery and then have continued to do exercise.
Yep.
Since that. That's 2. I've met 2.
Those are dedicated individuals, and they do exist.
Right.
And it does make a difference. However, if you could only just remove the trauma associated with surgery and old injury patterns, facilitate proper firing and biomechanics, then you don't need to do these exercises for the rest of your life. You just don't. You're going to do generalized workouts to improve your respiratory rate, to
bone density,
fun stuff, because it can get frustrating and demoralizing if you keep doing the same thing and you're not getting better.
Right.
Yeah.
Okay. We sort of touched on this, but I wanted to come back. What happens to a body during an injury?
Yeah. This gets into understanding physics.
We love physics.
Okay. And so the body is made up of soft tissue and hard tissue. You could call the hard tissue bony tissue or dense connective tissue, but also fluid-filled structures, because those fluid-filled structures are full of blood. And blood is essentially water, and water is non-compressible. Okay? Water is very dense. So our body's made up of these different densities of tissues. And when we have a fall or we're whiplashed and ragdolled, we're thrown all around, the kinetic energy entering the body with those injuries will no doubt injure the muscle and the skin and the soft tissue, but it'll also injure the dense connective tissue, the bone, and the fluid-filled organs, and it'll injure those areas more. So the reason for that is that the nature of physics is such that the denser the structure, the more it is disrupted or distorted due to the input of kinetic energy. So one analogy I use with people is, say you pick up your carpentry hammer, right?
Do you guys do that a lot in Canada?
Oh yeah.
Okay.
Everybody has a hammer.
Carpentry hammer.
I used to do construction labor actually before I got into massage. So pick up your hammer, right? Don't do this at home, folks. Just imagine it. Take your hammer, right? And you strike a piece of wood with it, right? Or your countertop. If you're feeling,
Gutsy.
yeah, seriously gutsy. What happens? It creates a dent in the wood, right? Take the same hammer, hit your pillow that you sleep on. What happens to the pillow? Nothing. It might fold in a little bit, but the fabric and the internal material of the pillow is so soft that the force of the strike passes right through it, right? And the pillow can absorb that force and the kinetic energy passes through it quite easily. But with the wood, the dent stays, right? It remains, right? Unless you go in there and sand it out. So the molecular structure, the atomic structure of the wood or dense object versus the soft pillow affects its response to kinetic input. Now in the body, so you have a fall on the hip, and you bruise your muscles and the force goes in. It does affect the muscles, but then it hits the bone, right? And the bone distorts in response to that input. It literally distorts. And you can see that on superficial structures with the naked eye, but you can also pick it up with specialized scanning procedures that we show with Matrix, right? So what does this mean? It means that when we have an injury, the denser structures of the body, the fluid-filled organs, and the skeleton actually absorbs a tremendous amount of that energy, and it becomes tense. This is what I say I was like, you know how your muscles get tense? Yeah, sure. It's like, how you can get like a tense nervous system? Yeah, everybody gets that, right? It's like, that can happen to your bones too. Your bones can get tense. And then a light bulb kind of goes off, like, oh, I never really thought about that. It's like, yeah, you have bone tension. The bones are connected to your muscles and your soft tissue. If you got underlying bone tension, it's going to reverberate into the soft tissue. This is the thing I was missing with massage, right? They had tight quads, tight hamstrings. They couldn't stretch them out. I couldn't massage it out, right? And then all of a sudden, I learned there's underlying bone tension, and I learned how to address it. You release the bone tension in a couple of minutes instantaneously. All of the quads, hamstrings is softened instantaneously because it was the underlying bone tension that was perpetuating the superficial muscular and fascial tension, right? And so when we have an injury, yes, the denser tissues are affected. They absorb these injury patterns. Our body then compensates around that to help us move through life and space. Eventually, we just have too much accumulated deep core trauma. And unless you understand how to find it and fix it, it's very hard to climb out of the hole. And that's what Matrix is so good at, identifying where these hidden strain patterns are, literally dialing back time on your body. That's why people, after they go through a series of treatments, they're like, I feel younger. You are younger. We've literally shifted your body back.
We've repatterned your bone.
We've repatterned your bone. Yeah.
So let's talk about treatments.
Sure.
Like, what's an average number of sessions you're seeing people? What does it look like to work with you?
Yeah. And that depends on the injury history and the age of the individual, right? If you're 50 years old and you've had a lot of injury, then you might need 20 or 30 treatments. But generally speaking, I'm seeing people between 8 and 12 1-hour sessions. So at session number 1, we do a thorough assessment. I'll know at that point in time if I think I can help with matrix repatterning, and the client will know if they want to pursue treatment. And we'll go through a series of 6 sessions, and usually by the 5th session, we're turning a corner. Even after session 2, there's measurable improvements in range of motion, stability, and the client can see it too. And so I know I'm on the right, going in the right direction, and they know there's improvement. And so as we move through each session, we're monitoring for objective improvements in range of motion, function, stability. If it's a concussion patient, we're looking at the Rivermead, right? So subjective and objective findings. The Rivermead questionnaire is just a set of questions to ask people about headaches and light and sound sensitivity and emotional disruption and how their symptoms compare now as to before the treatment, before the actual injury, right? So I'll ask them these questions. I'll check neurological tests, right? For say, eye tracking or balance and proprioception. And if we can see measurable improvement, I know we're headed in the right direction. Session 6, 7, 8 rolls around and they're already better. I'll give you an example. A couple of weeks ago, I was working with a young guy. He's 10, and he hit his head on the pool as he was turning around in the pool. So he's flip. And since then, it was a couple months before that it happened, before he came to see me. So for months after that injury, he couldn't swim. Off the swim team, not swimming, got nauseous in the pool, right? And we went through 5 treatments, and I was able to track those changes that I just expressed before. And he went in the pool a couple weeks ago, no issues, no nausea. He's able to do all the strokes. He's good to go, you know? And that is so cool to see, you know?
Yeah,
Feels really good.
absolutely.
Yeah.
I want to touch on something that you had just said, which is the word stress, which, I mean, who doesn't have stress?
Yeah.
And I wanted to ask if you think, because I think this is true for me, so I'm going to make it about me, is when you have a lot of accumulated trauma in the body, it is perceived as stress to other people. Like, people have told me now for years, Shauna, you seem really stressed. And I'm like, I am not even in grad school right now. Like, this is the chill version of me.
Yeah.
And people, especially in courses and who are really intuitive, will be like, you're really stressed. And I'm like, I don't perceive myself as being stressed. I perceive myself as like, this is low key, Shauna. Like, you think this is stress? Like, you should have had me in grad school. Like, you would have told me to go hide in a closet and take a breather. So, what do you think the correlation is between, this physical? I mean, I think we are now kind of seeing this age where there's a lot of mental distress that people are having. And how much do you think that's tied into physical stress that's your body doesn't, stress is stress and your body doesn't know what to do with it? How much do you think is physical versus a mental stress?
Yeah. A lot of it is physical. There's no doubt mental plays in, emotional, so many factors, diet, lifestyle, no doubt that plays in. But I can say from my own clinical experience, seeing people shift from a place of, say, chronic depression or anxiety, ADD, ADHD, like seeing improvements with addressing different regions of their body. Generally, the central nervous system structures, the spine, the head, the face. And so my feeling on this is that the physical stress doesn't help matters, right? Because if our biomatrix, our body matrix, right, is not supple, it is tense, it can't absorb and accommodate these other stresses that are coming in, whether it be EMF or chemical or mental or emotional, right? So by addressing the physical, at the very least, what you're allowing for is the body to handle more of these stressors. That's not to say people should get their life in order. Like definitely we should, address some of these other factors, because I'll say this, and it is that I have seen when someone is emotionally stressed enough or psychologically stressed enough, it'll limit what I can do physically with them.
Yep.
Right. Because
Right.
yes, because we understand that mental, emotional, psychological stress generates an electrical output. It's like a huge electrical generation factor that's spilling over into our nervous system. And unless that's addressed, the physical work that I'm doing is probably only going to be temporary. It helps, but it may only be temporary. So for folks that are, I can see like they've got a lot going on, I'll refer them out, like work with this counselor or work with this psychotherapist or, get into primal trust or do these different things that can help support you. Meditation, yoga, and all that's super empowering because a lot of that the person is learning to figure out how to help these parts of themselves. That's just going to help me in the clinic space and it's going to help them as well.
Thank you. Yeah, I think we don't often talk about the body component of that we kind of tell people like it's all in your head.
It's not.
It's not. Well, I'm here to tell you. I stand witness.
It's not. What I like about body work is it's like it gives people the opportunity to recognize and just take a look at some of the deeper emotional stuff. You know what I mean? It's like when you when you get body work, things start to occur, like thoughts start to come to you. You start to feel a connection with your body, become body aware, but it also is like a segue or an opening into other elements of your being. So what I often find is like as people get body work, then they are more body aware, and then they're more mind emotional aware if they're not already. Some people are really aware, right? And then they start to share things, you start, and this happens and has happened. You start treating a certain area and people might start tearing up, right? Or they're like, wow, I just had this memory happen. Why is that? There's this discussion around cellular memory, right? Certain traumas getting stored in the body. Whatever the case is, what I love about body work is it's like a non-invasive way for people to delve into the deeper parts of themselves, and it comes up naturally. So anybody ready to get into the more emotional healing elements of their journey will do so when the time is right.
I want to take it one step further.
No.
How is doing this work a spiritual practice for you and a spiritual experience for you?
Yeah. Well, I guess part of it gets back to this feeling that I get when people improve. It's 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 very rewarding. However, not everyone improves.
Yeah.
So anybody in the bodywork world understands this. If you're listening to this right now, in a day, I'll see 8 people, and it's 8 different stories. It's 8 different emotional sets, physical sets. So the first person will come in and they're like, I'm terrible. I'm not improving. Right. So we go through a conversation about, well, let's talk about what's not improving. Right. And then we come to find out, well, it's improving, but it's just very slow. But they're very frustrated, and they're anxious about their pain, and they're not sure if this is going to help, and how long is it going to take till I get better, right? Next person comes in, they're 80% better, they're elated, right? So what just happened to my emotions? The first person, I'm trying to be the rock, right, and explain to them, and be still and stable and be open, right, to show them and explain, hey, we're getting there. I can see it. You can see it. It's just taking a little bit of time. Next person comes in and they are elated. They're telling everybody, like, nothing has ever worked this good. I mean, like, why aren't you charging $1 million for treatment? So emotionally, I was like, wow, that's a big up, it's a big upper. So it can be emotionally a little bit of a roller coaster. And spiritually, I feel like, for me personally, the goal for me is to ride those waves in a kind of, I guess, in a way that I don't get pulled up so high and I don't get pushed down too far. I'm still super elated when people feel better, right? But I don't want to have self-judgment and some sort of feeling of inefficiency or inadequacy if someone's not getting better. So this is how it helps me spiritually, right? It's not about me fixing them. I have some tools that were presented to me, and I'm thankful for that. My mentor, Dr. Roth, presented this to me, and I feel fortunate and privileged to be able to share this with other people. If it doesn't work, it doesn't work. I don't need to hold that against my heart and take it home, right? Just refer them out, I don't need to carry that. And so I think body work in general could do this for people, but this is my journey with Matrix and body work, to challenge my ego, right? I'm not the doer. I'm not fixing it. I'm just offering some solutions. And if the time is right, it will happen. And if it doesn't, I don't need to get so uptight about it. I feel like my work it helps support my spiritual practice.
Yeah. I think that's a really beautiful way to put it, because I know that so many people struggle with outcomes, right? Like
Mm-hmm.
it's I- it's difficult to say either one, right? It's like either you, and I think sometimes we live in a black and white world, right? Black and white thinking. It's like either I'm helping this person and they got better, or I helped this person and they didn't get better. And like, what's my onus? And And I know as like a newer practitioner, right? Like it's hard not to be like cavalier in either direction.
Yes.
It's hard not to say, okay, well, I know that I helped coach this person get to this level, which I know even though I'm not practicing maternity, I know that I'm helping coaching people feel better in their daily life. But there are people who aren't going to get better. Like you could see probably the best practitioner in the world and they may not get better. And
Correct.
that's probably a them. That's probably more on them. And I think that's really hard to delineate because every person coming to you is a person and so it's someone in front of you. And yeah, I think there's a lot of lessons in that for the provider as well.
Absolutely. Yeah, I love this conversation. It's never talked about in schools, you know? So, yeah, it's a big conversation. And a lot of the time, therapists won't take time for themselves, right? So they burn out. They develop the disorders and the diseases. You know, they're the ones who are putting out so much, but not taking in. And so we do need to care for ourselves. I think coming from it as from humble as possible. I experienced this earlier in my career where there's more sense of ego. Like I know what to do. I know what needs to happen. It worked for that other person. It's going to work for them. Let me show you all these feelings, right? And just crashing and burning like so hard. And so that was a lesson in ego. It was like, oh, just be a childlike here. Like just come at it from like a sweet, innocent space. Like, well, this is interesting. Let's check this out, you know? And if it doesn't work out, it doesn't work out. And maybe it's something I missed. Maybe it's not. So in certain circumstances when, excuse me, when I'm struggling to treat certain people, I will then, there's a little protocol I have. I'll step back. I will reassess my view on the situation. I'll try to empty my mind, right? Just clear my thoughts, just still myself, reset. And I may even offer a few sessions where it's discounted rate or it's free. Because in that moment, it's possible I'm missing something. You know, I see really complex cases and need time to assess these people. So I might spend an hour with them where I'm just sitting there brainstorming, testing, looking at things. You know, it's like it's an opportunity for me to learn. And that's again back to the ego thing. It's like, okay, maybe I did miss something. Let me just take some time, see if I can figure it out, be open to it, you know? And that's a great opportunity for spiritual growth too.
Yeah, that's something that I really appreciated because I've been seeing Dr. Roth while I've been up here. And I think in school, this was really kind of vilified, was like, you need to have the answer right off the bat. Like, if you don't know it right now, you don't know it. And he's the creator of this technique. He's been practicing for 35 years. He'll look at me, say, I need a second to think about this. He'll close his eyes. He'll take moments to himself to think. He'll write himself notes and then he'll come back to me. And that has been such a gift because I feel like, especially as a student, it was like, if you don't know the answer right now,
Mm.
like you're a failure, you're going to be a terrible doctor. Like, what are you doing here if you can't tell people right off the bat what's going on? And so I like you both have been generous in your ability to pause, which is making me emotional right now because I think like we're told that like fast is better
Mm-hmm.
at everything, and just like the ability to pause is something that I think is a gift and something that I think everyone could probably benefit from is just like taking a second to like absorb and process information before moving on to the next.
I agree. It's so beautiful, right? It's what makes Dr. Roth so effective and special. And that quality is important. And I think, I mean, we can all relate to this. You know, you're spontaneous, you know, think things through. And after the fact, like, I really screwed that one up, you know? And whenever we're, say, making decisions in haste or in fear or anger,
Fear. Yeah.
it does not work out, you know? And as a matrix practitioner, I need to be on point. Like I need my mind to be free and open to connect all of the dots because we're looking at a complex picture here. So if I put blinders on, you know, and I'm in haste, I'm going to miss it. I'm going to miss the connections. And you miss the connections, you're going to be running around in circles for a while. So we don't want to run around in circles in life. No.
No, thanks.
No.
Okay. Is there anything that I haven't asked you that you would like to say about Matrix or your experience? Or is there anything that conclude us out? Like, is there something that I'm not asking or that I'm not perceiving that you want to share about you or this experience of being a Matrix practitioner?
I don't think so. I've loved all these questions. I've really enjoyed this conversation. I'm sure we could keep going for another hour or 2 hours. Maybe I'll come back and we'll do a follow up.
Part two.
Yeah, part two. Because there are other elements of assessment and treatment we haven't specifically delved into, but in order to go into that, we'd need a whole other hour.
Totally.
And other elements of the approach and body work in general that we can delve into. But no, there's no other specific piece of information that I want to share. Just thank you for this opportunity.
And how can people work with you? How can people work with Matrix practitioners? Should they want to? What does that look like? And say I've never heard of Matrix, right? I'm looking at the podcast for the first time and this is my first introduction to it. What are ways that people can connect with this information?
Yeah. So I have a professional website, oliverhartan.com. So if people want to connect with me directly,
your name.
I will. Oliver, Oliver, and then Hartan, Hartan.com. And so if you want to learn a little bit more about me and what I do, you can go there. If you want to see if you can find a Matrix practitioner within your area, check out matrixrepatterning.com. So it's Matrix, Matrix, Repatterning, Repatterning, matrixrepatterning.com. And there's a great little find a practitioner option there, and you can do a search. And you'll learn more about Matrix at that point. If you're a PT or you're interested in learning more about
Matrix. So sorry, I want to interrupt you. What are the qualifications of people who can learn this technique? I wanted to plug that for you.
Sure. So you do need to have a certain prerequisite requirements, certain qualifications. And so if you're in the US, you need to be a PT, an OT, occupational therapist, a chiropractor, an MD, and there may be a few other ones. And you can reach out to the Matrix Institute at matrixrepatterning.com to see if your designation is acceptable to enroll in the course. If you're interested in learning more as a practitioner, what you want to do is you want to head over to matrix4practitioners.com. So that's matrix4practitioners.com. And there's a lot of content on there, more focused towards the practitioner, videos, content. There's an area where you can sign up for courses and check more out about courses at that website.
I wanted to ask you one last thing about practitioners. Where do you see Matrix in 10 years?
I see Matrix worldwide in 10 years. We have a lot of practitioners in Canada and a growing number of practitioners in the States. In the next 2 to 4 years, I see many more in the States, many more. We have practitioners in Europe. We have practitioners in Australia and New Zealand. So in 10 years, I expect more countries and many more practitioners. So worldwide.
Let's go.
Yeah, let's go.
Thank you so much for joining me on today's episode. I'm going to do a little plug. So if you want to sponsor the podcast, one way you can do that is you can DM me at Dr. Shauna Burke. That's at DrShawnaberk. You can DM me hair quiz if you feel like you want to change up your hair care routine. I just changed up mine with a company called Monat, Monat. Would love to help you if you feel like your scalp health isn't where you want it to be. I think that's a big, I'm going to say, pattern in a lot of our culture right now. So if you want to be a part of changing up your hair care routine, let me know. I'd love to help you out. You have been listening to Authentically Shauna with Dr. Shauna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referred in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. Individuals on this podcast may have direct or indirect financial interest in products or services referred to.